So before I begin, I'm going to perform proper hand hygiene and wash my hands, and then I'm going to introduce myself to the patient. So hi, my name is Amanda. I'm going to be your nurse today. Can you please verify your name and your date of birth?
My initials are MS. Date of birth is 082696.
Okay, all right, and can you please tell me if you have any allergies?
Amoxicillin.
All right, and what kind of reaction do you have towards that? Hives?
Yeah.
Okay, all right, so then I'm going to go ahead and take his heart rate and respiration rate. So for the heart rate, first thing I'm going to do is assess whether it is regular or irregular. And since it is regular, I'm going to go ahead and locate his radial pulse and listen or feel it for 30 seconds and multiply it by 2 to get his beats per minute. And then for his respiration rate, I'm going to watch the rise and fall of his chest. One inhale and exhale equals 1 breath. So I would, again, watch those for 30 seconds, multiply it by 2 to get his respirations per minute. And then I'm going to go ahead and test the patient orientation. So I'm going to ask you a few questions. So can you tell me your name?
Matt.
Okay, and can you tell me why you're here today?
Assessment.
Okay, can you tell me where you are?
Hospital.
And can you tell me what day it is?
27th.
Okay, all right. So then I'm going to go ahead and assess the general status of the patient. So he is sitting upright. He appears to be in no acute distress. And so then after that, I am going to go ahead and inspect the general overall work of breath of the patient. And so overall, his work of breath seems effortless. He doesn't seem like he's in he's not consciously thinking about breathing or anything like that. It's happening very naturally. And so then I'm going to go ahead and inspect the neck for the trachea midline assessment. And from what I can tell, the trachea appears to be in place with no deviations. And then I am going to go ahead and inspect his chest shape. So, I don't see any barrel chest. And then I see a 1:2 AP to transverse ratio there. And then, so after that, I'm going to go ahead and palpate the trachea for a midline assessment, just to make sure that there are no deviations. So, okay, yeah, so his trachea is in place with no deviations. And after that, I am going to go ahead and palpate the length of his spine for any tenderness along the vertebrae. So leaning forward. Okay, do you feel any tenderness? Do you feel any tenderness? No? Okay. All right, and then I'm going to go ahead and palpate the ribs for any tenderness. So tell me if you feel any tenderness. Okay, all right, and then I'll do the back ribs. Okay, all right, so next I am going to go ahead and percuss the posterior lung fields. So lean forward. I'm going to go ahead and take my hand, place the middle finger down, then go ahead and take this hand and tap twice. Listen, sound. Okay, all right, everything sounds normal. So then I'm going to go ahead and start auscultating the anterior lung fields. So I'm going to take my diaphragm and I'm going to start at the apex of the chest. So breathe in for me. Okay, and again, breathe in and out. All right, and now I am going to go ahead and start at the second intercostal space to hear the right and left upper lobes. So first, second, go ahead and breathe in. Okay, breathe in, out. Okay, good. Keep it up a little. And then after assessing that, I'm gonna auscultate the lateral lung fields. So if you wanna sit forward a little bit, spread out your arms. Okay, all right, and breathe in. Okay, breathe in and out. Okay. Okay. All right, so then I'm going to go ahead and auscultate his posterior lung fields. So again, I'm going to start at the apex, so breathe in. Okay, and then I am going to go ahead and start. I'm going to find C7 and go down to T3 and start auscultating his lung sounds. So. Okay, and then when I auscultate the posterior lung fields, make sure that I always stay away from the scapula, so I'm not going over any bone. And when I am auscultating the middle part of the back, make sure that I stay in between the shoulder blades and the spine. So next I am going to go ahead and demonstrate egophony. So again, I'm going to take my stethoscope and lean forward a little. Okay, and then I am going to go ahead and have you say E, and I'm going to go ahead and do that where it suggests consolidation, or there might be possible consolidation. So can you say E?
E.
E. Again?
E.
Again?
E.
Again?
E.
Okay, and then if he had egophony, then the E sound would turn into an A sound. And next I am going to demonstrate bronchophony. And so for that one, I'm going to do the same thing where if there might be possible consolidation, I'm going to have you say 99.
99.
Yep. Again.
99.
Again.
99.
Again.
99.
Okay. All right. So then if he has bronchophony, then that means that there is most likely, so if there's an increased sound transmission, then that suggests consolidation. Okay, and then next I am going to demonstrate whispered pectoraloquy. And for this one, you are just going to whisper 1, 2, 3 at each. Ready?
Mm-hmm.
Just whisper 1, 2, 3.
1, 2, 3.
Okay, again.
1, 2, 3.
Again.
1, 2, 3.
Okay. 1, 2, 3. Okay. And so if the sounds are normal, then it would sound muffled since it is a whisper. Okay. And then finally, I am going to go ahead and assess chest expansion. So to do that, I am going to go ahead and anteriorly assess the outward expansion. So I'm going to put my hands here and breathe in and out. Okay. And then to assess the anteroposterior, I'm going to place my hands on his chest, breathe in and out. Make sure it rises and falls. Okay, and then lastly, just lean forward for me. I'm going to go ahead and assess posteriorly. So, all right, breathe in. And to wrap it up, I'm going to ask if you have any questions or concerns. Okay,